Rights groups say people living on the front line of a major U.S.-led offensive against Taliban militants in southern Afghanistan are trapped in their homes with little access to food and health care, and that thousands more who fled the area before the fighting began are receiving little help in harsh winter conditions. Residents living at the heart of the U.S.-led war escalation in Marja, Afghanistan, are desperate, and they are warning that their food and water supplies are running out. The need for supplies in the Taliban stronghold is becoming increasingly urgent for those who did not leave when the fighting began. Western officials are facing a major humanitarian problem in the aftermath of the assault named Operation Moshtarak. Yaqub Rashid, a shopkeeper in Marja, told The Independent, quote, "Most people cannot get hold of medicine or food, and people cannot work their farms. We are too scared to go out because of all the firing going on. We are also worried about stepping on bombs that have been planted. Neighbors are sharing food with each other, but we are now facing a problem. Many of us did not run away and stayed behind to protect our homes, but we need help." The number of those displaced by the major anti-Taliban military offensive has more than doubled in just a few days, according to Helmand provincial authorities. A spokesman of the governor for Helmand told United Nations news agency IRIN that so far, over 3,700 families, or some 22,000 people, have registered in the provincial capital of Lashkar Gah as displaced from the Marja and Nad Ali areas. Prior to the offensive, Marja's population was estimated at about 80,000 people. Over 40,000 are believed to be still there. Noreen MacDonald, president of London-based think tank the International Council for Security and Development, which is an office in Lashkar Gah, says military planners had paid little regard to civilian well-being. She told Agence France-Presse, quote, "The forward planning we heard so much about did not include ensuring that the local population would be able to leave and live elsewhere in decent conditions with access to food and medical care."